Let's come to the second part of intracranial hemorrhage. In the first one, I discussed about the meninges. Let's discuss about the epidural hematoma in this part. Epidural hematoma, it is actually a condition in which hematoma forms in epidural space. Epidural space is that area which is present in between the two layers of the dura mater. The green one is the outer periosteal layer, and down to it in the red one is the inner meningeal layer. Actually, the two layers of the dura mater does not have any real space. Okay, like these both layers are very close to each other. At some places, they get separate and form a dural sinus in which the cerebral veins drain. This is a dural sinus. In between these two layers, a middle meningeal artery runs, and actually, it is actually this artery which ruptures and leads to the hematoma formation in the epidural space. This is hematoma formation which form in the epidural space. Okay, now let's look at this one. This is the showing the base of the skull. This is the anterior cranial fossa. These two are the middle cranial fossa, and this one is the posterior cranial fossa. Actually, there's a foramen spinosum, and through this foramen, the middle meningeal artery, the MMA, the middle meningeal artery, it actually enters into the cranium and then divides into the two branches, the anterior one and the posterior one. The anterior one runs in the epidural space. Okay, let's come to the lateral view of the skull. MA refers to the maxillary artery. Actually, the middle meningeal artery is the branch of the maxillary artery, and maxillary artery is actually the branch of the external carotid artery. So this is a maxillary artery. It gives the branch middle meningeal artery, and then it divides into two branches, the posterior one and the anterior one. Okay. So let's come towards the point that why this epidural hematoma occurs. Okay, there are many causes for this hematoma formation, but the topmost is the head trauma, and head trauma, especially at the pterion region, is the most common cause. Okay, there are other causes too, but they are very rare. Very rare. The head trauma is the topmost common cause. Now, what is pterion? Pterion is actually present on the lateral side of the skull, and it is the thinnest area of the skull bone. Okay, this is actually the pterion region, and it is the joining point of the coronal suture, or the meeting point of the coronal and the squamous sutures, and it is also a point where the four bones get meet: the frontal, sphenoidal, and the parietal and the temporal bones. They get meet there, and it is one of the thinnest area of the skull bone that if someone get hit at this area, and if that area get fractured, then there are much more chances that the underlying vessel would get ruptured, and the underlying vessel is the anterior branch of the middle meningeal artery. If that vessel would rupture, it will lead to the hematoma formation in epidural space. Okay, as we know that just below the skull bone there's a dura mater, and we know in between the two layers of the dura mater there is a middle meningeal artery running. So if the skull bone get fractured, there are much more chances that this vessel would rupture or lacerate and will lead to the hematoma formation. Okay, so come towards the other causes which are rare, but they can lead to the epidural hematoma too. Okay, like fracture at the base of the skull. If the fracture occurs at the base of the skull, and if it damage that fracture damage the foramen spinosum level, then what will happen? It can lead to the damage or laceration of the middle meningeal artery too, and it can also present in a form of the epidural hematoma. Let's come towards the venous epidural hematoma. It is also very, very rare. Actually, what happens in this condition that epidural hematoma forms, but it is of venous, not the arterial, as this hematoma is the arterial, because this hematoma formed due to the rupture of the middle meningeal artery. Okay, so as we know that in between the two layers there's a dural sinus. If this dural sinus get torn, so what will happen? It can lead to the venous epidural hematoma. Okay, because there in this area actually the cerebral veins drain into it. So if this area get damaged, then the venous blood would accumulate in between the two layers of the dura mater, and we will call it as a venous epidural hematoma. There are also non-traumatic causes, like these one are the traumatic. Okay, the non-traumatic causes can be infection, can be coagulopathy, can be AV malformation. If we talk about the infection, like infections which spread from the bone into the blood vessels directly, and the blood vessels can get the necrotic damage, and they can lacerate, and they can bleed, and can lead to the hematoma formation. The infections can be otitis media, can be mastocytitis too. Okay, come towards the coagulopathy, where the coagulopathy due to the low platelets or due to the use of the anticoagulant drugs or antiplatelet drugs like heparin, warfarin, aspirin. If someone taking these drugs or having the low platelets, they are prone for this epidural hematoma. Okay, why? Because most of the time whenever we get a minor injury in a blood vessel, what happen? That it bleeds a little bit, and then clot form at the damaged area, and then it won't bleed much more. Okay, but what happens if there's a coagulopathy, like clot formation pathway is impaired? Okay, then what will happen if there's a mild injury to the vessel? That mild injured area won't get clotted. So what would happen? That it would bleed more and more and will lead to the hematoma formation in the last. Okay, in case of the AV malformation means the vessels are well formed, they can lacerate, they can rupture, and they can lead to the bleeding. Okay, come towards that how these patients will present clinically. Actually, after head trauma, they lose their consciousness, but that loss of consciousness is for a brief duration. Why? Because when the hematoma start to develop, what happen? Our body accommodate in a way that they increase the venous blood flow out of the brain to provide more space for the developing hematoma. Okay, then what would happen? They again gain their consciousness, but that consciousness would be for a temporary time, and that temporary conscious state we call it as a lucid interval. Do remember this point? This lucid interval point is the characteristic feature of the epidural hematoma. Okay, so why they get temporary conscious state? Just because that the venous blood outflow from the cranium to provide a space for the developing hematoma. But we should remember that the hematoma as due to the arterial source, and we know that the artery is having much more faster blood flow as compared to the veins, so the hematoma would be expanding very fastly, that the venous outflow won't accommodate the situations. The venous outflow won't provide as enough space for the developing hematoma, and what will happen? That after a short time the person would deteriorate. Okay, why? Because the developing hematoma, what it will do, it will increase the intracranial pressure. Okay, you should remember the Monro-Carey doctrine principle that the volume of the cranium is fixed. Volume of the cranium is fixed in a way that it is composed of the three structures. It's three things, like it is composed of the brain parenchyma, the second one is the CSF, the third one is the blood. If any of these three get increased, it will increase the intracranial pressure. Okay, and then the patient can present with the Cushing's triad symptoms. The triad actually composed of the three things, like the patient can present with the hypertension, systolic hypertension. Second one is bradycardia. Third one is a slow irregular respiration. Actually, what happened? That for the cerebral tissues to get oxygen, the arterial blood flow, the arterial pressure should be more than the intracranial pressure normally. Okay, but in this condition, what has happened? That the intracranial pressure has increased, so the arteries would compress and the arterial blood flow would be compromised. So what will happen? That the cerebral ischemia would occur, and the cerebral ischemia would lead to these Cushing triad symptoms. Okay, they appear because of the cerebral ischemia. As because there is a expanding mass of the hematoma, what will occur? That the brain tissues would compress and they can herniate from the one area to the next one. So there is a risk for herniation too. Okay, next one is the seizures attack, because normally the neuronal fibers are normally firing, but when the developing mass compress or irritate the neuronal fibers, they will abnormally fire. And when the neuronal fibers abnormally fire, what will happen? It will lead to the seizures attack. Okay, so these patients can also experience the seizures attack too. They can also present with a headache, vomiting too. Let's come towards the diagnosis, that if we are suspecting this type of case, then how we will confirm it. Do the CT scan if you are suspecting this type of case, and in the CT scan it gives the characteristic features through which we can easily pick up that it is epidural hematoma. Remember one point, as it is more common in the cases of the head trauma, and young population are more prone for the head trauma, so this epidural hematoma is more common in the young adults. Okay, come towards the diagnosis. Let's first look at this point, that in between the skull bones there are sutural ligaments, and you should remember that the dura mater actually fixed at the to the skull bone at the suture ligaments point. Okay, remember this point, that the dura mater is fixed to the skull bone at the suture ligaments point. So due to this reason, that it does not, if the hematoma develops in the dura mater, it won't cross the sutural ligaments point. These are actually the sutural ligaments, and this is the skull bone, and this is the hematoma. Hematoma is not extending away from the sutural ligaments. It is limited. It is in the boundary between the sutural ligaments. So it is a point for the epidural hematoma. Okay, it does not cross the suture lines. Okay, and due to which it gives a specific shape for this hematoma, lens shape, or we can call it as a biconvex shape. Okay, the next point is that it will look hyperdense or white. You should remember that the fresh blood looks more brighter than the brain parenchyma. Okay, and why it will be a fresh blood? Because as it is the arterial blood vessel laceration, so this hematoma will be expanding with a very fast speed, because arterial blood flow is much more faster than the venous. So most of the time that these patients would present in acute onset. Okay, so if we do the CT scan as a patient having acute onset of this hematoma formation, if we do the CT scan, that blood accumulate would be would be acutely, so it will look hypertense. Okay, it will look hypertense. Let's come towards the treatment. That if we are suspecting this type of case, and we find out, we investigated, through the CT scan. Yes, there's also MRI can also be done, but there are some points related to MRI that it is more costly. Okay, it takes more time. And the third one is its facility is not available everywhere, so we don't go to the MRI in most of the cases. Most of the cases we diagnose this case through the CT scan. Okay, a CT scan easily pick this type of the case. Now comes towards the treatment, that how we will treat these patients. Actually, most of the cases for the treatment we do towards the surgery side, because we have to evacuate this hematoma, because it can lead to the deteriorating effects. These are the dangerous one. They can lead to the death of the patient. Okay, so we have to treat surgically, like we do the craniotomy or the burr hole and evacuate the hematoma area. In craniotomy, what we do, we remove the part of the skull and we evacuate that clot, that hematoma. In the burr hole, what we do, a hole is made in the skull bone, and then that hematoma part is evacuated. Most of the cases, craniotomy is preferred over the burr hole. Okay, with that, we also treat the patient for the seizures prophylactically. Okay, and with that, as the patient might be having increased intracranial pressure features like symptoms, so we treat that too. Like we gave them hyperosmolar agents like mannitol, or can be given the hypertonic saline too. And we advise the patient to keep their bed uplift to the 30-degree, so that the blood would flow out of the brain unobstructedly. So this is the end of epidural hematoma.